In terms of my overall assessment of where we're going with the response, we are seeing cases still occur in areas outside southwestern Sydney, in southeastern Sydney, for instance, but those cases are tending to occur in household members and close contacts of known cases that have been in isolation for their full infectious period. In relation to Wollongong and Shoalhaven, again, we are redoubling back on all our cases to make sure our controls were in place. But again, the cases that have arisen there have been in close contacts and household contacts. In Western Sydney and Sydney, we are still watchful that there are no more cases in the community. We have been responding to some construction site clusters and tracking down a large number of construction workers who work across the Greater Sydney. But what our focus has really turned to is southwestern Sydney. In southwestern Sydney, we have seen a number of cases across multiple households. Now, on the good news, many of those households are linked. And the message is getting out, and can I thank those individuals for their cooperation? Again, to reiterate that health will maintain the privacy, and if anyone has erred in terms of met up with someone, we would much rather you tell us. What we are really concerned about at the moment is preventing any further chains of transmission containing these clusters across these multiple households, with some links extending beyond those households. The concern we've got, though, which is reflected in the numbers of the people that are infectious in the community, is the fact that by the time we get to those household cases, the rest of the household is already infected and so therefore has been unknowingly in the community infectious. We are doing that contact tracing, so when we have a case, we ask everyone in the household and their other contacts to be isolated, but what we've already found, even with that strategy, we are still having people infectious in the community. So the areas that we're particularly concerned about: Bosley Park, Smithfield, Fairfield, West Hoxton, Bass Hill, St John's Park, Canley Vale, Greenfield Park and St John's Park. So that area of the Fairfield local government area, with obviously some overlap and egress into Liverpool and Canterbury-Bankstown local government areas. As I said, I want to thank those community members for their cooperation. Please continue to work with our contact tracers in providing that advice about your movements. But in those communities, we are asking you to just redouble your efforts. Please stay at home. So if you're in those local government areas of Fairfield, Liverpool and Canterbury-Bankstown, please stay at home. Do not visit loved ones. Try and engage through digital means. Try and avoid any unnecessary contact with other additional households. And please limit your movements into any indoor environment. So only have one person go and get the shopping. As the Premier has indicated, if you have got enough food, don't leave the house at this time. And this will allow our contact tracers to identify people that may have been exposed so that we can reduce the number of unknown people in the community. And then the other message is, if you actually do have to move about in those locations, please do not assume someone is unknowingly infectious standing next to you. So keep your distance, make sure you're wearing those masks. And again, I would urge you yourself to minimise your movements in that community. Clearly, the objective of our response and the basis of the health advice is that with the transmissibility of the Delta strain, we want to approach any removal from the lockdown of having given it the best shot at removing any chance of community transmission. We believe that that is the best setting so that we're not having to be thrown in and out of lockdowns. So this is really a crunch time for the community, where the destiny is in your hands, and we've done it before. And the communities of southwestern Sydney are a vibrant, connected community, and you've tackled previous outbreaks and done so well. I'm asking you this time to even redouble those efforts and work with us to get this under control. But I also don't want the rest of the community of Greater Metropolitan Sydney to take their eye off the ball. Anyone else in the broader area, please continue to come forward and get testing. Look at those venues of concern. Please follow the public health advice.